Question is that my hairline is receding and can I use minoxidil or other question. Second question is, can minoxidil save my hair loss? So we need to address those hair who are getting thin. We can bring them back into the full terminal full hair of 80 to 90 micron. Nowadays the boys coming to my office at age of 18, they start getting bald. What would be happening to them in the age of 20, late 20s and early 30s and late 30s and early 40s? What would be happening to them? They get bald. He can be saved from getting big bald in these areas. So it is not only about minoxidil. It is not about only about minoxidil. It is about a complete treatment. Question is that my hairline is receding and can I use minoxidil or other question. Second question is, that is question related to this as well, because he says that can minoxidil save my hair loss? It is not about only minoxidil. Androgenetic alopecia starts in early 20s and goes up to 80s. Keep in mind, androgenetic alopecia is regression of growing phase, anagen phase, and when it regresses, the hair, they become thin and then fall down, and that area becomes bald. So we need to address those hair who are getting thin. We can bring them back into the full terminal full hair of 80 to 90 micron in certain time period. But the thing is, for how long you can keep these minoxidil and finasteride taking? For at least two years. This is my saying, because I have a lot of experience in hair fall treatments, in hair fall prevention of hair loss. So I stress always on hair loss prevention. Once the boys who they start getting bald in age of 21 or 22 or 23, or even nowadays the boys coming to my office at age of 18, they start getting bald. What would be happening to them in the age of 20, late 20s and early 30s and late 30s and early 40s? What would be happening to them? They get bald to maximum like grade 7 or maybe more than grade 7. And at the same time, their donor area will keep squeezing. What would be doing? What would be happening to them? We could not fill up the whole area who's been bald in these ages. So we need to take care of hair fall from early 20s. So what we can do is we can start treatments of hair fall at age of 21, 22 when it is coming in office, and for 2 years. And what would be happening after 2 years? We will get a break after 2 years, and he will be having like no hair fall for next 2-3 years. Maybe a 21-year boy after taking 2-year treatment can reach to 25. And after 25, when he starts feeling thinning again, you can give him 2-year treatment again with the minoxidil, finasteride and some sort of vitamins, PRP or anything you can give along with finasteride and minoxidil. Then if you give 2-year treatment at 25, you can push that boy to 29. So the most dangerous zone when the boy gets hair fall in the age of 20-21, the most dangerous zone for him is from 21 to 29. So we need to protect at least these 10 years, this decade of that young boy. We can take him, we can drag him with the same number of grafts, same number of follicles to the age of 29 with finasteride, minoxidil and other things periodically. like 2 years, then break, then 2 years, then break. So he can be saved from getting big bald in these areas. So it is not only about minoxidil. It is not about only about minoxidil. It is about a complete treatment. We need to block dihydrotestosterone. We need to give some stimulators with the modulators, and we need to give some helping instruments as well, adjuvant therapies, you can say. I'm not against those as well. You can start PRP, but without finasteride and minoxidil, there is no use of giving PRP or anything else to treat the hair fall. In androgenetic alopecia especially, we are talking about genetic losses, we are talking about androgenetic alopecia, and treatment for those is with finasteride, minoxidil, and we can give finasteride, minoxidil up to 2 years at least in a one go, and after that you can take a break and you will not feel sudden losses after 2 years. The losses can happen again, but after some time, after 2 years, after 3 years, after 4 years, and again when you start feeling hair loss or thinning, you can start with finasteride, minoxidil. Thank you very much.